Good morning, I'm Dr. Deuk here at the Deuk Spine Institute, and we're broadcasting spine surgery performed live for you. So you can ask questions and you can ride along with us during this patient's cervical spine surgery. This patient has two herniated discs. One is larger, C5-C7, the other one, C6-C7, is smaller. It's more of a disc bulge. So we have a larger herniation at C5-C7, a small herniation at C6-C7. Our patient has neck pain. It's coming from the herniated disc, bulging disc at C5-C6, C6-C7, in my opinion, based on the physical exam, the MRI, the type of symptoms he's having. And he comes from Canada, so he's traveled here to have the Deuk laser disc repair. As you can see from the first x-ray image, we're placing a needle at the C5-C6 disc, and using the AP view, we are in the midline. You could see the midline. Jordan, show us the midline where the spinous process is. Yep, right there. And then show the disc. Yep, right there. And that's the middle of the disc right there. We're starting at 5-6, then we'll go to 6-7 later. And let's go with the lateral view. We're going to use a combination of AP and lateral views to navigate our needle to the right spot. All right, Jordan, count for us. C2 down. So C2, 3, 4, 5, 6. And that's the 5-6 disc that we're at. Everyone agree? All right. So I'm going to advance my spinal needle into the disc shot. I'm through the annulus. I'm in the middle. And at this point, we're going to do what's called a discogram. Now, our patient is not awake. Patient is completely asleep with a tube down and on the ventilator with our anesthesiologist monitoring them. And we're not going to get an evocative discogram. We're going to get what's called a chromodiscogram. And a chromodiscogram is just looking for the architecture of the inside of the disc. Specifically, we're looking for an annular tear. All right, you guys ready? Here we go. Shot. So I've injected dye. Now show them the annular tear in the back of the disc. Huge tear right there. There should not be dye there. Let me do a little more. Shot. All right, show them the tear. You can see the black tear right there. That is an annular tear, a wall tear that allows the herniation to come out through the back. All right, the neck is supple. I've had my anesthesiologist, Dr. Berndes. Not only is the patient asleep, but also they are what we call chemically paralyzed. Chemically paralyzed means that we have put in medicine to relax their muscles. And that's important because you can't do this particular surgery, cervical spine, endoscopic surgery, in my opinion, without chemical paralysis. Now, I'm not the only surgeon in the world that does endoscopic cervical spine surgery. There are some surgeons in Korea that do it. As a matter of fact, I learned the endoscopic technique from Dr. Sang-Ho Lee and Dr. Gun Choi at Woodydal Hospital and Dr. Hellinger in Germany. So this approach was taught to me. However, the actual Deuk laser disc repair is a surgery that I developed here at Deuk Spine. All right, so we're going to make a 4mm incision. This entire surgery, folks, is going to be essentially a bloodless surgery done with a 4mm incision. Okay, we're going to have maybe 1 or 2 drops of blood, that's it. Our patient travels to Florida from Canada for our lovely weather and for our services. At this point, I've made the incision. It's 4mm. It's a Band-Aid incision. Let me see. We're taking the spinal needle out, and I'm going to leave the guide wire. Now, I'm going to bring this dilator down over the guide wire. Can you see this, Henry?
Yes, we can.
And what this does is it creates a passage through the soft tissues. Look at the tip of this dilator. You see it's tapered.
Yes.
Tapering allows an instrument to spread tissues rather than cut them. So we're actually, every other surgeon that does an anterior cervical decompression infusion or artificial disc, they're going to cut your tissues and damage them and cause scar tissue and bleeding. Because we're not cutting, we're actually spreading. We don't do the damage. And the entire surgery is done through a tiny little incision. Jordan, are you recording the amount of fluoro from now on?
Yes, sir.
I need you recording it on my operative sheet. See that sheet over there, the white sheet at the top, how it has estimated blood loss? Have them add fluoro time, or just put fluoro, and you're going to put the amount of seconds as well as gray or centigray. Can you do that?
Yes, sir.
Yeah. Shot? That way we're tabulating how much radiation we're exposing the patient to. And I know it's this very small amount. Now take a look here, guys and gals. See the little hole, the incision around this tube right there?
Yes,
There's just enough room to get a little bit larger tube in. And that's the tube we're going to do the surgery with. Shot? All right, so I'm at the front of the disc. Let's get an AP view. I'm going to show you on the AP or anterior posterior view that we're in the middle of the spine. And the way you know that is you line up the spinous process in the middle, and then you make sure your tip is in the middle. And there you go. Show us the spinous process. It's right behind the temperature probe. You can see the braided temperature probe wire. There it is. And you can see how the tip is right in the middle, the tip of the dilator in the front of the disc. Okay, good. Take that lateral. So now that I've got my dilator into the annulus in the front, I'm going to remove my guide wire, and I'm going to advance the dilator through the disc. Now, people ask me, are you damaging the disc? The answer is no, because we're spreading the annular fibers. They're fibers. They run top to bottom. They're basically moving aside so that we can bring this dilator down through the disc. The center of the disc is jelly, so it doesn't care if you put a dilator in it. It's going to go back to being the same shape it was before the dilator. Now we're at the back of the disc where the annular tear is. I can feel the tear. Show them where the annular tear is, Jordan, on the x-ray. So the annular tear is right where this dilator is. We're sitting inside the tear where the herniation came out. And that's what we're going to debride, is that annular tear. The Deuk laser disc repair, this surgery you're watching, is the only surgery in the world that actually does what's right, which is to remove the herniation and clean the tear from which it came out of so that the tear will seal. There's no other surgery in the world that does that. And we were the first to do it 16 years ago. So in 2006 was when we did the first Deuk laser disc repair. And how many years ago was that? That's now 17 years. Going on 17 years. Okay? We're not the first to do endoscopic surgery, but we're the first to do an annular debridement and clean the tear from which the herniation comes so that it can heal and so no more herniations come, as well as no more neck pain. By cleaning the annular tear, we get rid of the neck pain. Shot? All right, now you can see the tip of the tube is at the front of the disc. Now, a lot of people get confused with the side view. They see the tube is big, the side of the disc, it looks like the tube is taking up the whole disc, but they're not understanding the three-dimensionality. So give me a second, and then I need some inline traction. Let's show our audience how small this tube really is compared to the actual disc itself. Give me 1 second. I just want to get it started. All right, that's perfect. Now let's show the audience an AP view so they can understand the tube is not that big. Any questions, Henry? Oh, you're hitting the IV bag. Okay, this is too close. You got to move your stuff back. Okay, this is a sterile plastic.
No current questions.
Shot? All right, there you go. Show us the disc side to side. There's one side, there's the other. See how big the disc is and see how small the tube is? There you go. So people worry when they see the side view, it looks like the tube is taking up the whole disc, but it's not. It's a very small part of the disc. All right, Henry, let's go ahead and show the audience why does people that have a herniated disc or a bulging disc, why do they have pain in their neck? Shot? A little inline for me.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. Now you understand how a herniated disc causes neck pain, arm pain. It's through inflammation going on in the back of the disc where the tear is. And it's not just the tear. You need a tear plus a herniation together interacting to cause neck pain and arm pain. Unfortunately, 99.999% of doctors don't know this. They really don't know it. They believe that it's the size of the herniation that matters, but it's not. It's actually the amount of inflammation. So you can have a small herniation causing horrible neck pain and arm pain, even though it's tiny. And these surgeons won't operate on you. They'll just tell you to go get shots or take pills. And lives are being destroyed and ruined by that because it's wrong. We figured this out at Deuk Spine Institute. It's an inflammatory problem, and even small herniations need to be fixed to give people the quality of life. All right, take a look at how small this incision is. You guys see this?
Yes, we do.
4 millimeters. The entire surgery normally would be done with a huge incision, okay? If you go get an anterior cervical discectomy infusion or an artificial disc, this is what they're going to do to you. All right, now just compare that to that. This is going to, the big incision will cause scar tissue, bleeding, trauma to your muscles, your blood vessels, your nerves. They're all getting traumatized. How do I know? I've done 1,000 of these surgeries in my career, okay? And so I'm very familiar with it. And for a long time, that was the best we could do. But now endoscopic is by far the best. The entire spine world will eventually go to endoscopic. Unfortunately, it's been corrupted by greed and ignorance. And so until that gets fixed, people are going to still get fusions and artificial discs, which they shouldn't be getting. All right, so this is the endoscope, for those of you wondering. This is a suction line. This is the light source, the camera. This is the endoscope. This is the laser fiber. This is the irrigation. And this is cold irrigation. Hope you enjoy watching the surgery. We're going to start by fixing the C5-C7 disc. You can see a herniation right there, the blue stuff. How do I know? Because we used a blue stain to stain the herniation. And only the nuclear herniation gets stained with that blue stain. All right. There's the laser fiber. You all see that at 12 o'clock?
Yes, we do.
Excellent. Well, we're going to get started by lasering out the herniation. I'm going to tell you something. There is no tool that comes close to the laser. It is the best, and without the laser, we wouldn't be able to do this endoscopic surgery. So there's surgeons out there saying you don't need laser or laser's foo-foo. They're wrong, dead wrong. You cannot do endoscopic surgery without a laser properly. If you have questions, feel free to ask us. We type them up and we'll try to answer them for you. There's a piece of herniation there. It takes about 15 to 20 minutes per disc once we're in. And after we're done with this disc, we're going to move to the next disc, which is the C5-C7. So what are the symptoms of a disc herniation? Well, there's neck pain, arm pain, weakness in the arm, numbness in the arm, and tingling. Each one of these little fragments here, the blue things and white things, are herniations. Each one is individual herniation. So look at that herniation right there. See that thing? That is a big herniation, and it's sitting right where the tear is. I'm going to try to grab it out because lasering it out will be too hard. I'm going to grab it and try to pull it out. The laser is used to free up the fragments. It's also used to debride the annular tear. Well, we just published our results at the Southern Neurosurgery Society meeting for the thoracic Deuk laser disc repair. And we've had a total of, I want to say, 15 patients. And after 1 year of surgery, 1 year after surgery, the average amount of thoracic pain relief was 99% of axial pain. Each of those are pieces of herniation there. The irrigation is nice and cold, folks. Nice job. The average amount of radicular symptom relief, thoracic radiculopathy, was 96%. So the laser surgery on the thoracic disc herniations works quite well for axial pain and radicular symptoms. Any questions from our audience?
Yes, we have a question from WYT Rose on YouTube.
Hello, WYT White Rose. How are you today on YouTube?
And they asked, can I ask if I send you the images, I believe they mean MRI images, what do you need? What's the phone address? I believe I asked already.
Uh-huh. So, White Rose, what you're asking for is an opinion, and we're happy to provide it. We actually offer that service. And I'm going to have Henry type up the address. But it's a process. You have to add in some data. We're going to need to know where your pain is, if it goes into your arm or leg, which side. So we have a questionnaire online, and we have the ability for you to either upload your images off of your CD or to mail your CD to us. But if you mail it to us, we don't mail it back unless you send us postage. We can't be, with all the MRI reviews we do, we can't be sending people back their MRIs paying for it ourselves, if it's a free service especially. So yes, we offer a free MRI review and consultation virtually, no charge to you. However, you are expected to fill out the form online and send us your images. Now, a report by itself is not enough. I don't make surgical decisions based on reports because radiologists often miss the cause of people's pain. And that's why there's so many people that have pain, even though they've had an MRI, because the radiologist is missing the source of their pain. And I don't miss the source of people's pain usually. I do a pretty good job at Deuk Spine of figuring out where people's pain is coming from, but it requires that I actually look at the MRI images myself. Most neurosurgeons are trained to look at the MRIs themselves and formulate their own opinions about the cause. That's why we don't just go based on a radiologist report, because there's too much inconsistency with the radiologist. All right, what we have here is these fibers we're starting to see are the posterior longitudinal ligament behind the disc, and I'm looking for any holes in the PLL, or posterior longitudinal ligament, because most disc herniations are contained. And what a contained herniation means is that it's contained by the posterior longitudinal ligament. It doesn't go past the PLL. What's beyond the PLL down there is the dura, or spinal cord. The dura is the covering of the spinal cord. It's part of the meninges, which are the coverings over the spinal cord. So basically, most herniated discs in the neck don't go past the posterior longitudinal ligament. And about 90% of them, in my experience, do not. Which means, once you see the PLL, you've done your job as a surgeon to get rid of the herniation. Now notice the bone spurs right here. Watch what the laser does. You see the laser is removing the bone spurs. I get this question a lot. Dr. Deuk, can the laser remove bone spurs? Can you remove bone spurs? There's another herniation right there. So the answer is yes. The laser can easily remove bone spurs. But people say to me, when you do the surgery, are you going to take away all the bone spurs? The answer is no. If we take away all your bone spurs, then we're doing more than is needed to be done. Okay? And some bone spurs are okay. They don't need to be removed. It's only the ones that are pinching on the nerves that need to be removed. Okay? So, and it's only the disc that's pinching on the nerves that needs to be removed. That's why what you're seeing here, even though it looks big, is actually 4 millimeters wide. You know that laser fiber you're seeing right there, how wide do you think that laser fiber is? It's 0.5 millimeter wide, 0.5 millimeters. So here's a herniation. So think about how small this incision really is, or how small the tube really is. It's literally the tube that you're seeing right here, side to side, is about 2.8 millimeters. Okay? 2.8 millimeters, not even 3 millimeters. That's about 2.8 laser fibers, almost 3 laser fibers across. That's how small this is. And that's why we don't get bleeding. That's why we don't get pain after surgery. Patients don't need painkillers after the laser surgery. They take Tylenol, and that's it. No opioids are necessary. We were just talking about that this morning in our staff meeting, how the Deuk laser disc repair is so safe because there's no need for post-operative opioid pain medication. Now see this here? We're out in the foramen on the right side at C5-6. There's a bone spur right there I just got rid of. And there's still some herniation here I have to get rid of, but that's where the nerve is, the nerve root, okay? It's right out there in the foramen. And we've almost got the foramen empty on that right side, but it needs just a little bit more work. All right, questions while I'm doing this?
I believe we do have a question from White Rose once more on YouTube. And I'm just, forgive me, it's just the wording of it is a little confusing, but the question I see is that's okay? Do you want my info?
Yeah, White Rose, we don't need your info. You need to go to the website and you need to fill out the form and send us your MRI. All right? This is a self-directed exercise. So why don't you put the link? We're going to give you the link right now to the MRI review. It's MRI.DeukSpine.com. Okay?
I apologize. They just responded back. They said, "Sir, I have so much done. It's caused a lot of damage. My goodness, it's a big, huge one, herniation, I believe, at C7."
Yeah. No problem. There's no herniation we can't fix unless you have a very short, fat neck, which, you know, we'll figure that out. But that's the only time we have trouble is when somebody has a neck that is short and they have a high collarbone. But any surgeon's going to have trouble, even with anterior cervical decompression and fusion. So far, everything's going well for this patient. We're almost done with 5-6. We're going to go to 6-7 next in just a moment. But we're going to take your questions. If you have them, there's another herniation right there and another. This is off to his left arm. So it just goes to show there's herniation sometimes on the side that doesn't have symptoms. And it's just a matter of time before people get symptoms. All right, if there's no more questions, let's go ahead and show our audience what are we doing down here with the Deuk laser disc repair. How does this work?
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, welcome back. So we're just about finished at C5-6. I was turning off the irrigation. When you turn off the irrigation, you can see small little places where some blood is coming out. You can actually almost see individual red blood cells. I'm going to turn on the irrigation. It sweeps everything out. It just goes to show you how important the irrigation actually is. Irrigation is the flow of liquid in the wound during surgery. And not all surgeries require irrigation, but most of them do. These are bone spurs right here I'm removing for him. A little bit of herniation in the foramen right there. Just zapped it away. Remember, he's from Canada and I don't want him having to come back, so I want to do my very best. I do that for every patient anyway, but we want to make sure we try to get everything we can. Looking good. Go back to the other side. Just about done here. Yeah, thanks. Everything is going as well as could be. See that area right there? That used to be full of herniation. Now it's not. Man, my hand is literally freezing. I love it. You guys are... I'm not complaining. I'm complimenting. That's the foramen. That's where the nerve is. So there's nothing sitting on the nerve anymore, okay? There's just a little bit of foraminal ligament, which is normal. Oh yeah, I wanted to show you all. This is cool. That right there is center of the disc, and that's scar tissue, the white stuff on the posterior longitudinal ligament. And that's from inflammation, chronic inflammation. And that was in the center, right? That was kind of in the center there. So that's where his neck pain comes from. All right, we're pretty much done here. I don't see anything, no more herniations. We're done, okay? Woo, my hand is freezing. You guys did an awesome job. How do we get such nice cold irrigation? Cold irrigation is important for the laser. All right, that's betadine. What is betadine? It's an antiseptic. We use it to, how come my suction is off? My suction's not working here. Come on, we gotta have suction working, guys. All right, let me have some irrigation. We use antiseptics because when you do surgery, it's always good practice to cleanse the wound with an antiseptic that could kill bacteria or viruses or protozoans. And we don't have protozoans and viruses obviously here, but we do potentially have bacteria. That's the real threat. And the most common cause of post-operative infections in surgery in general, and not with the Deuk laser disc repair, but the most common cause of infections is bacteria. It's bacteria that cause infections, not viruses. And these are post-operative infections. So these are infections where we do surgery. Okay, not a virus, not a protozoan, not funguses would be the second most common. So bacteria is about 95% of post-operative infections, and fungus is about 5%, maybe 10% maximum. Depends on the patient population. Let's go, Jordan. All right, at this point, we've finished the 5-6 Deuk laser disc repair. We're going to move down to the next level, which is 6-7. But we need to get our x-ray machine, which is called a fluoroscope, in position. That's beautiful right there. Just keep it there. All right, so everyone's got to do their part. We're going to need a shoulder, like a little gentle traction on the shoulder, but not yet. First thing I'm going to do is I'm going to take this tube out, and then I'm going to leave my dilator. So I put the dilator back, taking the tube out. You all see that shot? Now I'm going to move this tube, this dilator, sorry, out of the disc, and I'm going to move it to the next one down. All right, let's get started. We need a little shoulder action, a little inline traction, head straight. I need my team helping me, and I'm going to move this thing out of the disc and to the next one. Shot, I'm out. I could feel it. I want to stay in the midline. Let's get a shot. AP. All right, so we're going to crawl our way right along the bone. And there's something in front of the bone here. It's called the anterior longitudinal ligament. I'm literally going to slide down the ALL. I've got to stay in the middle though. Shot. All right, so I move back to the middle. Let's go back to a lateral. You cannot let the tip of this dilator come off of the ALL. It must stay on the ALL. If you let it come off the ALL, you could let the esophagus underneath you, which would be bad. Now, I strongly recommend before you do endoscopic surgery, shot, that you first do a lot of open surgeries, unfortunately, which most doctors will get anyway in their training, most surgeons, with anterior cervical decompression infusion or artificial disc. So perfect, we're in the middle. Then you could see the anatomy or use my video archive. We have on YouTube 1,000 surgeries you can watch. They're not all on our channel, but Henry's working on that project. But a lot of them are on the channel. Shot. All right, AP. But you could watch anterior cervical decompression infusion surgery and you could see what I'm talking about. The esophagus sits right on top of the spine. All right, perfect. So you see how the tip is in the middle? Show us, Jordan. The tip of the dilator is in the middle of the spine. Show us the esophageal temperature probe. You see that braided probe? That's the esophagus. All right, notice how it's deflected to the side, right where I'm working. And then show us the endotracheal tube, which goes into the trachea, and where it ends. And show us, yeah, it ends right there, above the carina. All right, lateral, AP view, sorry, lateral view. All right, perfect. So we're in the middle, we're over the disc. I need to enter the fibers. I'm going to advance the dilator into the disc. I'm going to angle it a little bit. Shot. I need a little shoulder. Perfect, guys. You guys are awesome. Shot. So this disc is a really much better disc than the 5-6. Shot. Now we're going to do a discogram. Because we want that blue dye. It stains degenerated nucleus pulposus. And let me just say this, shot. The herniated disc itself is degenerated, okay? And that's, the blue dye helps us. The Deuk spine blue dye helps us see that. Not bad. When I can't stick it in the hole, you know it's time for me to retire. Shot. All right, we need a little more shoulder pull, guys. A little more shoulder. There it is. Oh, you can actually see the herniation. Show us the herniation. Shot. Yeah, right there. Perfect. All right, I put a little more, I think. Did you do another lateral? Try that. There we go. So it's about the same. So you can see the herniation. You can see I'm not quite at the tear. I'm almost there. Shot. Now we're at the tear. I could feel it. Now we're at the back of the disc, right where the herniation is. And that's where I want to leave my dilator. Now sometimes the disc will push the dilator out. Shot. Yeah, see that? It pushed the dilator out. Just a little bit. We don't want that. And the reason why it's pushing it out is that this disc is under tons of pressure. It is not normal to have pressure like that. And that comes from inflammation, from the tear. that we're about to fix. That pressure, and that pressure is painful. It hurts patients. It pushes against the annular tear and the inflammation in the annular tear, and it creates neck pain, headaches called cervicogenic headaches, cervical brachial syndrome, which is pain radiating from the neck into the shoulder. All right, we're going to radiate, shot. Is that it? Yes, sir. All right, good. So it hasn't moved again. I'm holding it in place. So the actual dilator, the part that's in the disc near the tear, is getting pushed out. Shot. Oh, there we go. Nice. Great job, guys. Oh, shoot. See that? It literally came out. Show that. Show us where it popped back. Can you see that, Henry?
Yes, we can.
Yeah. And I could feel the pressure. So this is not normal to have pressure in the disc when somebody's laying down. You know, maybe if you're lifting 200 pounds in your arms, you're going to get pressure in your disc. Shot? Because, of course, everything you lift with your arms goes to your neck. So I have to keep stopping and putting it back. And I'm putting it right into the herniation because I want to pin it there so I can get this tube right where I need it. Almost there. Shot? Just about done. Perfect. That should be good right there. All right, I'm happy with that. So I've brought the tip of this tube, Jordan. The tip of the tube is at the back of the tear. Show us where the tear starts. Nope. Inside. There. Right there. Right where the arrow is. That's where the annular tear starts. And show us where it ends. There. So our tube is literally sitting inside the annular tear where the herniation came out of. And the Deuk laser disc repair is really a surgery about debridement of the annular tear. Some people ask me, why does it have a code, an unlisted procedure code, a 22899? The reason is there is no CPT code in existence that for the Deuk laser disc repair specifically because it's its own unique procedure. Sure, it's part of endoscopic spine surgery, but it's a unique type of endoscopic spine surgery. Just like there are different kinds of fusion, there's different kinds of disc surgery. You have A-lift fusion, anterior lumbar interbody fusion. You have T-lifts, you have X-lifts, you have O-lifts. So there's many different ways to do spinal fusion, and there's many ways to do endoscopic spine surgery. And this Deuk laser disc repair is the best way. I've taken all the other types of spine surgery, and this is the culmination of the best technique for all surgery. Now, the nice thing about this surgery is there's no metal being put in, no structural metal. There's no fusion being done of the bones. It's all unnecessary to do that. It's always been unnecessary, by the way. It's just that doctors didn't know how to do this before. Now we do. The problem is most doctors don't know how to do it. Therefore, they're not going to talk to you as a patient about it, which is why we broadcast so people can learn the truth. You can learn about this surgery that's far better than open surgery with fusion or artificial discs, laminectomy, laminoplasties. All of those surgeries don't treat the source of pain, which is the tear. The only surgery in the world that really treats the tear is the Deuk laser disc repair. Now, some surgeries will take the herniation out and fuse you, but the fusion is only necessary because they've removed your entire disc just to get to the herniation. The herniation is a small little thing. You guys see these herniations? You don't need to take the whole disc out to fix the herniation, but that's what most surgeons do. And when they take your whole disc out, guess what? Now they have to fuse you, or they have to put an artificial disc in. So the need for artificial disc, the need for fusion, is because the surgeon doesn't know how to do this endoscopically. Isn't that crazy that all these surgeons are doing fusions over 1.5 million in the United States, spinal fusions a year, because they don't know how to do this, or they don't want to do this, because it doesn't pay as well as a fusion? It's sad. All All right, look at all this. This disc did not look that bad on MRI, but it's definitely worse than the MRI appearance. All this is herniation here. You can see the fibers right there, those white fibers down there. That's your posterior ligament. And all this is herniation, the blue stuff. So this is scar tissue and herniation right here. And there's the tear. You see the blue? The blue highlights the tear. That's why we do the blue dye. It shows us the tear. It shows us the herniations. It shows us the degenerated part of the disc. That's a bone spur right there. I just blasted it away. All right, do we have any questions?
We have a couple comments and a question.
Yep.
These come from White Rose.
Before you do that, I want to show you something. Look at the annular tear, folks. See the shredded fibers right there? That is the annular tear. And I'm debriding the edges. There's no other surgery that does a debridement of the annular tear, unless they're going to fuse you. But go ahead. Yeah, this is scar tissue right here. Go ahead.
And from White Rose, the comment says, from the advice that you gave out earlier, they said, okay, thank you, thanks for that, sir. I am tiny and have 0 bone marrow squamous from the implants. FDA just recognized mine. My screws have fallen out. That looks much better than, talking about the Deuk laser disc repair. That looks much better than screws, and I'm so very excited. These screws are falling out. And then their question is, I am from Idaho. I don't have internet on purpose. So you are East Coast time. It will be a while till my mom comes by. I have it here. I just got it the other day, triple Q. Afterwards, does that grow back?
What was the last thing you said?
I just got it the other day, triple Q. Afterwards, does that grow back?
Yes. Yes, this will grow back. So White Rose is asking, once we do this surgery and we fix the disc, will the disc heal itself? There's a herniation right there. You see the blue? Yes, the disc will heal itself. That's correct. But it's only going to heal itself with this surgery. There's no other surgery in the world that will allow your disc to heal itself naturally. But the Deuk laser disc repair. There's another herniation. All right, let me see if I can get it out with the laser. No, it's too big. So we're going to go grab it out with the grabber. Yes, White Rose, we agree with you 100%. There's so many people with failure of their fusions, hardware failure, loose screws. All of that's the same thing. It's bad, bad, bad. There's no need for that anymore. This surgery takes care of all of the disc problems: stenosis, herniation, bulging, neck pain, shoulder pain, headaches. Laser, please. Okay, all of those problems that come from the disc as the source, which is spinal stenosis too, by the way. A lot of people don't understand spinal stenosis comes from a herniated disc. All right, there's another herniation. You see that herniation was pushing on the nerve. It was causing a narrowing of the spinal canal, more herniation. All of these herniated pieces are where the neuroforamen is. It's where the nerves are. So they are taking up space they shouldn't be taking up. That's like normally you're living in your house with you and your mom, and then 50 more people show up suddenly and try to live in your house. You would have stenosis of your house, or narrowing. All right, you would get narrowed out because there's too many people. So we're going in there and removing all the people who aren't supposed to be there. Basically, these herniations shouldn't be crowding out the nerves. The nerves are supposed to live in the spinal canal and the neuroforamen by themselves with just some blood vessels, some supporting tissue. But when the herniation happens, it goes and takes up the space where the nerve is. And now the nerve is fighting, and it's going to lose because the herniation is like a non-caring, non-feeling person who doesn't care. You know what I mean? Just living in your house. You say, get out of my house. They don't listen. They don't care what you say. And when push comes to shove, they're more physical than you. So you can't really physically get rid of them. The nerves are basically strangulated in stenosis by these herniations. Okay? So we're removing the herniations, we're freeing up the nerves, we are treating the spinal stenosis. Just the 5 minutes, we're done. 5 minutes, we're done. So the laser is the most important tool. These surgeries cannot be done without it. Someday, all the spine surgeons in the world are going to be doing this surgery because the metal that's being put in people's necks and backs is going to go away. People are going to get too smart and they're going to realize, I don't want metal. There's no need for metal. Right now, there are 2 million spinal fusions in the United States done every year. And all 2 million will be replaced by this surgery you're watching right now. You may have just a few that are done, maybe 3 to 5% will still be done for tumors, unstable spines from trauma, fracture, dislocations. Really, those do need fusion, okay? But the degenerative causes of fusion, the vast majority of spinal fusion is done for what are called degenerative issues, where you get a herniation or trauma to a disc, and then it doesn't result in gross instability, but it results in pain and radicular symptoms, spinal stenosis. That will be treated with this surgery. All right, we're done in 1 minute. Just want to clean this last bit of tear right here. Now, if you have questions, feel free to type them up. I'm going to come and answer them for you face to face. And I'm very happy you guys are watching, but we're just about done with this Deuk laser disc repair cervical, which is the neck, for 2 herniated discs, the 2 most common to be herniated, C5-6 and C6-7. All the herniation is now gone. I'm looking at, the posterior ligament. I don't see any more pieces of herniation. The annular tear has been debrided. This should heal beautifully without any more pain for this patient. Now, of course, there'll be a little bit of discomfort tonight after the surgery, but by the way, this is outpatient surgery for those of you who don't know. We are not at the hospital. We're not going to the hospital. All these surgeries that you're watching are done in our surgery center. It's an outpatient facility. We've been doing these surgeries for 16 years here at Deuk Spine, okay? We have a very nice facility. I have a team of the best team of doctors and support staff that you could ever ask for. It's been rough over the years. We've had some bumps, but now we've got a great team of people and we're doing great surgeries and helping a lot of people. So if you're interested, you feel free to fill out the free MRI review form and get our opinion through a virtual Zoom consultation. Any questions now before I end this? I'm going to show you guys the whole surgery was done through a 4mm Band-Aid incision. This patient will probably end up going home in, 45 minutes to an hour? Of course, home is Canada, so for him, he's going to go to his hotel or his brother's home. His brother lives in Florida.
Yes, we have a couple questions.
All right, save them for me because I'm pretty much done. And I'll just come and answer them over there, all right? I just want to finish this. Just a few more little pieces here. That's why you have to be very thorough. This is a scarred up piece of herniation. That one there. That's it right there. Done. I don't see anything more. Looks good. So I'm going to come and answer your questions. Feel free to type them up. I'll be there in 5 minutes. But I do want to show you all the whole surgery was done through this tiny, tiny tube. And again, this is endoscopic spine surgery at its finest. What we do different at Deuk Spine than other surgeons that do endoscopic is we do an annular debridement. We also have our patients asleep and completely relaxed. We call it relax, where their muscles don't move. And unfortunately, I know the Koreans, for example, that I learned the approach and the endoscopic technique from, they keep the patients awake, and the patients are squirming around on the operating table while they're trying to do the surgery. They've had a few patients get paralyzed over there in Korea, which is why I don't do the patients awake, and I have flawless technique. I've done over 600 cervical Deuk laser disc repair, the kind we have now that we just did, and I've never had a paralyzed, nerve damage, CSF leak, infection, blood clot, hematoma, nothing, because we're extremely careful about everything we do here. There's a lot of, you know, if you watch me, it looks like kind of haphazard because I'm talking and seem distracted, but there's actually a very specific little things that I pay attention to during the surgery that have to be perfect. One of them is blood pressure control, right? And then of course, placement of the needle in the beginning is very important. And of course, moving the dilator along the front of the spine is very important. You have to do it just right. All right, let's take a look at the incision. You ready, Henry? Little venous bleeding. So I'm gonna hold pressure for a moment, but basically you can see the incision right there. You guys see that?
Yes, we do.
All right, our blood loss is around 1 cc, which is around 20 drops. So when you have a little vein bleeding, you just hold pressure for 4 minutes and it stops, okay? But that's vein bleeding. You see how dark the blood was there? If it was artery, it would squirt up and it would be bright red. But we've never had arterial bleeding, only vein if we ever have it. And, you know, all surgery has bleeding, but the amount that we have with this is, you know, 20 drops of blood. Thank you. Compared to 200 milliliters. So 1 milliliter versus 200 milliliters with open surgery. And some surgeons have 1,000 milliliters of bleeding. You know, obviously they don't know what the hell they're doing, but you know, there's a lot of surgeons out there, unfortunately, that don't know what they're doing, to be quite honest with you. Surgery training is not equal, unfortunately. Like anything else in life, there's huge discrepancies in training and skill and knowledge and compassion and just all those variables. And if you want the very best, you go to Deuk Spine. I've had many, many spine surgeons want to come work here, and I've told them no because they don't have the right personality for me. And I won't hire them unless they're, you know, perfectionists in every manner. Okay, I'll come talk to you in a few minutes, type up your questions. And Henry, would you put the mri.deukspine.com link so people can use that to get a free MRI review?
Copy that.
And check out our app, the Deuk Spine Institute app on iPhone and Android. You can actually download it for free, and it's got a lot of good information. All right, let me come talk to you guys in a minute. Over and out. Thanks, everybody. Wonderful job. It is February 23rd, 2022, and I'm here with one of my patients who's traveled from Kansas. Is that correct?
That's correct, Wichita, Kansas.
Wichita, Kansas, and clearly you've had surgery. We just did it less than 24 hours ago. You've got your incision there on your neck. How are you feeling today?
Much better. Much, much better. 26 years ago, I had a fusion of C6 and 7. They told me in Wichita that I would need to have fusions of C4 and 5 and C5 and 6. They set up the surgery for the 23rd March. And I'm going, I can't wait that long. This thing hurts, it's killing me, I cannot sleep, and so on. My husband Dale did a whole batch of research online, and he says, I want you to be able to move your neck after surgery.
Yes.
And
I did
he did a lot of research, and we found Dr. Deuk to be a man of integrity. He films all of his surgeries. He puts many of them online, and you can see for yourself all the good work that he's doing. And that he really, really likes to help people. What he does is generally not covered by Medicare and not covered by some other insurances, but it very well should be, because it really helps people.
So what was life like for you before surgery?
My pain was mostly in the neck and shooting down my shoulder, and especially in my shoulder.
And you had really bad weakness with your arm. You couldn't even lift your arm, right?
That's
before
correct.
surgery?
That's correct.
Show us what you can do now.
Before surgery, I could lift it to about here, and now I can lift it.
All the way up.
Just the next day, right
You couldn't
after.
do that before.
Yeah, that's because she had a herniated disc, two of them, C4-5, C5-6, and the herniations were literally sitting on the nerve. And we got in there, and if you watch this video segment right here, you can actually see there's the laser, and as we're removing the herniation, it literally pops right out of the foramen where it was sitting on top of the nerve, crushing the nerve. So, and the surgery was a success. We lost almost no blood at all, and you can see your incision is tiny. And here you are one day after surgery. It was outpatient, and you're ready to go home, right? You guys flying
Going
back
home tomorrow.
tomorrow? Okay, very good.
Try and enjoy a little bit of Florida today before we go back to the snow.
Okay, it is snowing there, huh, in Kansas?
Probably.
Okay.
If not today, then tomorrow.
Well, stay another week.
And yesterday it was 70
I
degrees
wish.
there.
70 degrees where, in Kansas?
Or maybe that was the day before it was 70 degrees, and
nice.
then they woke up to about 11 degrees.
Ah, so the cold front came in. We get those from time to time, and it gets cold around 60 degrees. Well, most of the time it's very pretty here in Florida. Well, we're glad you're here. Is there anything else you want to say to the world about herniated discs in the neck and surgery?
Dr. Deuk will give you a free look-see on the MRI. It's well worth your time. And he will do a Zoom call with you and tell you what he can do for you. So go for it.
I said that it was so important that I said I'd pay for it. You know, because we got a little bit of a nest egg, and sure it's going to cost a little bit, but it was worth it because we got results. I mean, that's amazing.
Your health is the most important thing in the world, people's health. So
You can't take it with you when you
yeah.
pass away.
All right, folks. We'll have a safe travels back.
Thank
Great
you.
to see you. Glad we can help you out. That's a nice.
Thank you.
That's a nice shake. This is Dr. Deuk Major. I'm here with one of my patients who underwent the Deuk laser disc repair on his neck just yesterday. How you feeling?
I'm feeling better, a lot better. Already, after years of chronic neck pain, I'm already feeling better within 24 hours.
So is the pain that you had when you came here, do you still have that pain?
Not that pain, it's just, I think, a little bit from the surgery itself, but it seems like a lot of the numbness and the tingling in my hands went away, and already starting to feel a lot better.
Now you had a fusion done before, not by me, and you can see the scar there. And then you had the laser surgery done yesterday. And how would you compare the two experiences?
Night and day. I actually, when I had the fusion, had to go back to the hospital with complications. It just took a long time to recover from that. So this was much, much better.
Your fusion on your neck was done by a pretty famous neurosurgeon, right?
Correct.
Even with him doing it, there were still issues.
Yes.
What kind of problems did you have with the fusion?
Well, I went there for the numbness in the hand and still the chronic pain that I've had for many, many years. And it seemed to take away the numbness in my hand, but the pain was still there. So I spent many, many years going to chiropractors. I've had injections, I've had massage therapy, physical therapy, and most of them gave a little bit of relief.
Did any of them get rid of your pain?
Not completely, no. Just kind of made it bearable.
And is your pain gone now?
It's certainly getting there. I'm thinking probably within a week it'll all be gone.
And your surgery was done, even though you had a metal plate in your neck from your prior fusion, we were able to work around the plate and get in there and fix those discs, especially the C3-4, which was, you can see a lot of herniated disc material in there that was causing most of your symptoms. So I'm happy you're doing so well. And you had it outpatient, so you didn't even have to go to the hospital.
Correct. Yeah. Left in about an hour and a half.
What are you going to do now that we fixed your neck?
Well, I'm going to take care of it for the prescribed 6 weeks, and then hopefully I can start getting back to a normal life, be able to get back to golf and things I like to do. Dr. Deuk and his processes here and everything's amazing. If you have a lot of chronic neck pain or back pain, I would highly suggest coming to him.
Awesome. All right, my friend. Congratulations.
I think the laser is the best thing out there to have with this type of surgery. It's all legit. That's all I can say about it.
Dr. Deuk Machen here at the Deuk Spine Institute. I'm with one of my patients who's traveled to us from Mississippi. And he came here for the Deuk laser disc repair to be done for a herniated disc on his neck. And he's now here today, just one day after surgery. How are you feeling today?
Feeling great. Feel like the weight of the world been lifted off my shoulders. Feels a lot less pain in my shoulder, no more tingling. Feels like my body's trying to recover back to normal. I think the surgery went very well, no problem whatsoever.
And you're just one day after surgery. Can you tell whether the neck pain is gone yet?
The neck pain is gone, and the pain throughout my shoulder, the tingling, everything is gone. A little soreness in my throat. My voice is a little harsh, but other than that, I feel great.
Awesome. Can you show us your incision? Oh wow, look at that. So you have a 4mm incision. You can see that right here on the surgical footage of the endoscope. We actually, when you watch the video, you can see all the herniated discs back there. We were pulling them out one at a time. You had about 20 pieces. And then you can see the nerve root right there in the foramen. And there's no herniated discs anymore on the nerve root. We got them all out of there. I had to open up the posterior longitudinal ligament and get all those fragments of disc herniation out of the epidural space that were pushing on your nerve. And I got a good look at everything and it looked fantastic. So I think you're gonna do great. Did you consider having like a fusion surgery? Did anyone offer you fusion before?
Yes, I was offered fusion. I was told that was the only surgery that could be done. I started Googling. I come across the laser surgery and I decided to give it a try. And I don't regret it. I think it was the best decision I ever made for my age, and I think the outcome would be a lot more better in the future. And it was a great experience. It really was.
And you work with metal as your job, so you didn't want metal in your neck, on your spine.
No, I think the cold weather would have had an effect on it. I think it would have caused an adjacent effect, is what they call it. When you do the fusion, it make the disc below it or above it wear out. And I'm 34 years old, and if I live another 30 years, I just feel like it would cause significant problems. I think the laser is the best thing out there to have with this type of surgery. It's all legit. That's all I can say about it.
This is Dr. Deuk Machen, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients, and you've traveled from where to the Deuk Spine?
Idaho.
Idaho, with your lovely husband, and we've had a few conversations. She came here to have her back fixed. How long have you had back pain for?
For over 7 years.
Okay. And what kind of work did you do before you retired, if you don't mind me asking?
It was desk work.
All right. And so you had back pain for 7 years. Did you have an injury to your back, or did it just kind of gradually come on?
It just gradually came on. I actually noticed it first in 2015 when I was gardening and I couldn't be up there for 8 hours. I was into it for about 4 hours and I had to take a break. And as time progressed, my breaks got longer and longer, and the amount of work I did in the garden was less and less.
Understood. And you're retired now. So what's it like having back pain limit your ability to do stuff when you're retired?
For me, it's very frustrating. I can't do that what I want to do. So we kept seeking solutions and nothing was working. They did work for a short while, but that short while decreased over time. It was shorter and shorter. My husband does research very, very well. Through his research, he found you. We read that you can fix my back, and you did fix my back.
That's right.
And I thank you.
You're welcome. So when did you have the Deuk laser disc repair done and the Deuk plasma rhizotomy?
I had those done yesterday in the afternoon. I am sitting straighter than I have. I'm standing straighter. I'm walking normal. It's like, wow, new me.
Look at that smile right there. I hadn't seen that until just now. So
well, it wasn't there yesterday.
Yeah, it wasn't there before surgery. And how long have you been not smiling because you've been in pain? I mean, really bad pain. How long has the really bad pain been there?
Well, the really bad pain has probably been over the last 5 years. It's something that was really tough to maintain a positive attitude and try to keep a smile on my face and keep Jeff's hopes up. I tend to be a positive person, but there were times when it does drag you down.
Of course, yeah. It's hard living with chronic pain, and especially with loved ones, they have a hard time, relating. Of course, they want to be supportive, and your husband is a very supportive man, obviously. And he's a pleasure to meet. I know he's an author as well. Yes. And so what are you going to do now that you've had the surgery? And you could see actually the Deuk laser disc repair procedure she had done yesterday. You can see right here, we went into the discs that were damaged. You had 2 annular tears. We tested your discs during the surgery, and indeed they were causing your pain. So we verified that with our discogram. And then I went ahead and used the laser to clean up the tears that were causing your pain and get rid of that source of pain for you. And here you are, you're doing fantastic. How much of your back pain from before surgery do you still have?
Oh, virtually nothing.
It's gone.
It's gone.
Cured.
My lower back, I have not been without pain in my lower back until your surgery. It's constant, it's always there. I've never been without it. I'm without it now.
So are you going to go back to gardening?
You bet I am.
All right, very good. And what other things would you like to do now that you have a new back that doesn't hurt you anymore?
The biggest thing I want to do, I want to go fly a kite.
Good for you. Let's go fly a kite then.
That's right.
Well, congratulations on having faith and being brave and getting it done.
Oh, not a problem.
Is there anything else you want to say to your fans out there?
I highly recommend Dr. Deuk's Spine Institute, Dr. Deuk personally, to help you fix your back.
Thank you. Appreciate that. All right. Safe travels.
Phew, that wasn't too bad, was it?
It was wonderful. And this is Dr. Deuk Majin. We have completed our surgery on our patient who traveled from Canada to have the Deuk laser disc repair done. And really, in essence, this is 2 herniated discs in the neck, C5-C7, one of them larger than the other, but both of them causing neck pain, pain in the neck, headaches called cervicogenic headaches that come from the neck up to the back of the head, pain radiating from the shoulders, neck into the shoulders called cervical brachial syndrome, and of course radiculopathy in the arm with some weakness because of the pinched nerve. And rather than doing a fusion surgery, which involves going in and removing the entire disc itself and getting to the herniation in the back, putting in a cage made out of plastic or PEEK, it's really carbon, but we call it plastic anyway. You can see that cage right there. and then putting a metal plate over it. So this patient would have had 2 discs removed, cages and a metal plate. Didn't want that. So instead, we went through a tiny incision endoscopically to the back of the disc where the herniation is, and I removed the herniation. I also cleaned the tear from which the herniation came out. This way, the wall or annulus where the tear is will seal off. Usually it takes about 9 months to a year to fully seal. Surgery went very well. We didn't have any complications. I was very pleased. We got all the herniation out and everything looked good. We got the stenosis treated as well. All right, do we have questions?
Yes, we do. This first one comes from Sunil Patel on Facebook, and they asked.
Hello, Sunil.
They asked, what are the chances of getting an infection after surgery?
Sunil is asking, what are the chances of getting an infection after surgery? Well, it depends on what surgery you have done, Sunil. In general, with spine surgery, the chances of infection are around 5% on average. And I could tell you, if you go through the front on the body, whether you go through the neck in the front, the chances are lower. If you go through the back of the neck or the back of the back to get to the spine, chances are much higher. Now, with the surgery you just watched, the Deuk laser disc repair, we've had 0 infections in 16 years. Over 1,600 surgeries now being done. We've had 0 infections. So what's the chance of getting an infection with our surgery? It's less than 1 in 1,600. Basically less than 1 in 1,000. Very, very small, but it can happen. Typically, infections happen because of a variety of reasons. One of them is dirty instruments. So the facility where you have your surgery is very important. If that facility doesn't keep up to date with the best equipment, maintenance of the equipment that sterilizes the instruments, or if the tissue is not cleaned off the instruments from the last surgeon, then you can get an infection from the instrumentation or the equipment that's used that they're putting in your body. Okay. One way to reduce risk of infection in spine surgery is to use disposable equipment because it comes prepackaged in sterile packaging, so it's a one-time use. There's no need for sterilization. But in general, almost every spine center uses reusable metal equipment, and it has to be sterilized properly. So if the facility doesn't have a good sterilizer, if they're not maintaining the sterilizer properly, if they're not setting the parameters on sterilization properly, if the tissue isn't being cleaned out of the instruments properly, you can get an infection from the actual facility and its equipment. Another way to get infection is if you have an infection somewhere else in your body, if you have an infected tooth or an infection somewhere else, it could spread to your surgery area. So smaller incisions, less likely to get an infection. That's why endoscopic surgery is wonderful. We don't really get infections. Also, other factors include, sterile technique, the surgeon not contaminating the instruments or the assistant not contaminating, sterile prep and drape, sterile bandages and things like Ioban and DuraPrep that we use. So we use countless measures. I mean, literally the maximum amount of sterility protection during surgery at Deuk Spine Institute that anyone can use. And most other facilities cut corners to save money. We were talking about this the other day. On each patient, we spend around $250 just to prevent infection. Most places that do treatments on the spine like this, pain management interventional treatments, they don't spend more than about $10 per patient per procedure. So we go above and beyond at Deuk Spine to prevent infections, and it shows in our results.
All right. Next question comes from White Rose on YouTube once more, and they asked, QQQ, is it from what we eat or work, lost vitamin?
I wish I understood the question,
Yeah, I
but
apologize.
I'm not sure what you're asking. Anyway, maybe you can rephrase the question, White Rose. All right, next question.
Next question comes from WM Carroll on Facebook, and they asked, what type of follow-up is needed after surgery?
The type of follow-up needed after this surgery, the Deuk laser disc repair, there is no follow-up. We see the patient the next morning just for a quick check, and then patients go and they don't come back generally. Sometimes we'll see people back if they're having an issue. I would say probably less than 10% of the patients have something they need to come in and be seen for. But 90% of the patients just come in for the surgery. They're seen the next morning just for a quick wound check, and then they're done. There is really no follow-up because we're not putting any metal in your spine. So there's no need for x-rays. There's no need for checking the metal. There's no need to check if the fusion is taking because we're not doing a fusion. So most follow-up from spine surgery is because complications happen or because metal is put in the body and the surgeon has to check the positioning of the metal over time, or because fusion is happening and they need to check the fusion. But we don't do any of that. There's no complications, there's no metal, there's no fusion. There's no need to come back in. Patients do fantastic, their symptoms are gone, and they're very pleased, so there's no reason to follow up.
Right.
And I would just say follow-up can be virtual. We have a lot of our patients, 80% of our patients come from out of the area. They travel here to Deuk Spine from other states, other countries. So if they do have an issue, we just do a Zoom call.
Okay. This next one is, I don't believe it's a question, and maybe seeking for advice. This comes from Carlos on YouTube. And they said, "Good day, doctor. I have pain in my lower back. My doctor told me I have arthritis. He prescribed me painkillers, and that was it. I don't feel any pain whatsoever when I am lying."
Yeah.
Well, when lying down.
Yeah, I understand. Not when you're lying, but when you're lying down.
Yeah.
Carlos, great point. You have a probably bad disc causing your pain. We can fix it here at Deuk Spine, and you don't have to lie down anymore. Carlos, your story is so common. People get a herniated disc in their back or neck, and then doing things, activities, being up, being around, working, just doing regular activities of life, hobbies, they aggravate that herniated disc. It makes it more painful, and therefore people stop doing anything. They just take it easy. And what's happening is you're basically robbing yourself of your quality of life. Maybe you can't go to work anymore. You can't keep your job. Maybe you can't go out and hang out with your kids and do things with your kids or your spouse. The point is that back pain and neck pain is now curable with this procedure at Deuk Spine Institute. You're not going to find it anywhere else right now. It has to be done here. But alternative treatments are doing nothing, taking pills, getting shots. None of those things are going to fix your problem. They're all going to cause the pain to come back, and you're going to end up sacrificing your quality of life by having to lay in bed all day or on the couch. So come to Deuk Spine Institute, get fixed, and get back to a normal life.
Okay, we have two more. This next one comes from SARS Logistics Incorporated on YouTube. No?
SARS.
Yeah. Oh, a third one just came up. They asked, or they said, I had an infection after the C5-C6 post-surgery for screws. They bolt out from C6. I had in me a PICC line for 6 weeks. That's all good.
Yeah, so I'm very sorry to hear your experience. One of our viewers is talking about how they had a fusion done with metal and screws on the front of their spine. Just to give you an idea of what we're talking about, you can see the metal plate on the front, and there are actually screws that bolt the plate to the spine. So they got an infection from their surgery. It wasn't done here at Deuk Spine. We don't get infections. But that caused the screws to get loose and everything fell apart. So now they have what's called the PICC line, which is a catheter that goes into your heart, and it drips the antibiotics into your heart. The reason for that is if you just put the antibiotics and it drips into your veins, it'll cause your veins to get inflamed, and your veins will close off and die, basically. So they put a PICC line in because you're getting antibiotics for a long period of time. Most spine infections require about 8 weeks to 10 weeks of IV antibiotic therapy every day, multiple times a day, hanging the antibiotics, drizzling them into your veins. So you can't just have a little peripheral IV access point, otherwise your vein will clot off and die. So they put the catheter into your heart. Hey, look folks, this is serious stuff. This is what I've been preaching for years. Stop getting spinal fusion, stop getting metal put in your spine. Stop having bad surgery done. Go to a reputable place like Deuk Spine Institute. We don't have infections here. We don't have many complications at all. With the laser surgery, we've had 0 complications from the surgery in 16 years. I cannot overemphasize the importance of safety, safety, safety for patients. Safety is number 1, 2, and 3. Why do you think Deuk Spine Institute doesn't have infections or complications from our surgery? Because we do it right. That's why. It is not done right everywhere else. If you believe spine surgery is the same everywhere, you're a fool, and I can't teach you anything. You have to understand, it is not the same. It is absolutely not the same. Okay? And, you know, if you don't believe me, you're just going to end up putting yourself at risk for complications that are completely unnecessary.
Okay. This next one comes from Diane on YouTube. And they said, I had a laminectomy and fusion from C3 to T1. I now have a condition they call cervical dystonia pain. They suggested Botox. That pain seems to radiate down my spine.
Yes, first of all, thanks for sharing. You are talking about a fascinating issue that honestly I struggled with as a surgeon in the very beginning of my career many years ago. And what you're talking about is a procedure where the surgeon goes in the back of the neck, and there are muscles that literally sit on the back of the spine. It's the filet mignon muscle, basically. And the surgeon makes a cut in the back of the neck, moves the muscles off your spine, okay? Gets down to the bone, and then removes the bone, called a laminectomy, and then does a fusion. And then we put everything back. Here's the problem. If you don't do that surgery right, and there's 100 ways to do it wrong, and 99.9% of spine surgeons do it wrong, okay? And you had one of those surgeries. If you do it wrong, you kill the muscle during surgery. You devascularize it. Basically, it doesn't get enough blood supply and it dies. The entire muscle bellies that are the filet mignon that hold your head up, they turn to scar tissue. And maybe only 10% of that muscle is left, maybe 20%. You can see it on an MRI, tons of scar tissue. That's why your neck hurts, because the few muscles that are left, the 20% that survived the surgery, are working overtime. Imagine if you have a business that has 10 employees working all the time, and then you fire 80% of them, and you only have 2 left, and they're doing the work of the other 8, plus their work. It's not possible, okay? These are the truths of spine surgery, the stuff that I need you guys to understand so you can make better choices about surgery. There is the right way to do a cervical laminectomy and fusion, and we have those videos online. But there are things that happen during that surgery that we don't show you, that we do at Deuk Spine Institute, not because we don't want to show you, but because they're part of the preparation for surgery. It's the preparation that's important, as well as the surgery itself. It's the positioning of the head. It's pitting in the Mayfield. It's extending. It's making sure that when you do the surgery, you have not too much blood flow, but just enough blood flow. And we use muscle relaxers heavily during that surgery to basically keep the muscles physiologically not demanding oxygen and glucose, okay? What kills the muscles is the fact that they don't get enough blood flow, and what's really in the blood is oxygen and glucose. So an active muscle fiber that's firing and firing and firing wants oxygen and glucose. If it doesn't get those 2 things, it will die. And so what's happening is your muscles are dying during surgery because they're not getting enough oxygen and glucose. Well, the way that I deal with that, and I figured it out, and this is me personally, that's why my patients do so well with PCDF, is that I make the muscle cells isoelectric, meaning I hit them with a muscle relaxer that stops them from being metabolically active. So they don't consume oxygen and glucose during those hours. They use very, very little. They're basically in hibernation. And I learned to do that about 18 years ago. And ever since then, my patients don't have that horrible muscle pain that you're describing. But before I started doing that, they did. And I went around the world asking the best spine surgeons in the world, how do you prevent that from happening? And none of them could give me an answer. None of them. And then I took my principles of neurosurgery, which if people have brain surgery and we're clipping an aneurysm, if we're going to clip the aneurysm and stop the blood flow to the brain, we put the brain in what's called a pentabarb coma. It basically shuts down all the neuron activity, so the neurons become in hibernation. Therefore, they don't use oxygen and glucose. Therefore, they can go for a long time without blood flow while you're clipping the aneurysm. I took that principle and applied it to muscles. Nobody else in the world has ever done that. I did. That's why you come to Deuk Spine, because we have very creative solutions for the problems that all these other spine surgeons struggle with and ultimately patients suffer from, because the surgeons don't basically think outside the box and come up with solutions.
This next question comes from White Rose on YouTube, and they ask, does the degenerated disc have to do with any of the foods we eat, or loss of vitamins, or working?
Degenerated disc has nothing to do with the foods you eat or vitamins or any of that nonsense. Degenerative disc come from one thing: inflammation in the disc. Doesn't matter if you have an anti-inflammatory diet, it will not stop the disc from degenerating. There's only one thing in the world that will, and that is the Deuk laser disc repair.
And follow-up question with Rose, I believe they're asking, they asked, how do you numb? I believe that's like before the procedure starts. How do you numb patients before insertion?
How do you numb the patients? Well, great question. This one surgery we just completed, the patient was actually asleep. We had the tube down, they were on gas anesthesia, they were knocked out, completely out. Therefore, numbing them is not as important, but if you go back and watch, I actually put some numbing medicine in the skin before we cut it. So that will numb the pain nerves so that they don't get a subconscious pain response with elevated blood pressure or heart rate. Great question. Thank you for asking that.
And we got this is a comment from SARS Logistics on YouTube, and is basically saying, unfortunately, fusion is just more about the money rather than saving the patient himself.
You are correct. Fusions are done for money.
Yeah.
That's exactly why fusions are done. And artificial discs, okay? And laminectomy and discectomy. They're all done for money. Why? Because when you do a laminectomy and a discectomy, you don't put metal. But guess what? That patient's coming back again for metal. And the doctor knows it. It's basically an annuity. You're doing a little bit today, but you know the patient will be back free to get more surgery with a fusion next year. So you're basically putting a layaway plan. It's shameful. The entire spine industry is completely corrupt and broken. Whether you're talking about pain management, totally corrupt. Even worse than spine surgeons. And then you got spine surgeons putting all this metal unnecessarily in patients. That's why we do our show, so you people can learn the truth, because nobody else is going to tell you.
And we have a comment from White Rose. They said, I can tell you with mine, the metal screws fell out. So did my uncle. What happens in both spurs start to form? They failed on one of the ones below. Starts to stress. This looks much better than putting metal in. And then
Thank you, White Rose. We appreciate your sentiment.
And then we have a question from Sharaf on Facebook, and they said, my MRI was done December of 2021. I asked you, Dr. Deuk, if that will work. You said yes, but the MRI, but Deuk MRI review said that may need a new MRI, but my doctor ordered me a bilateral lumbar decompression L4-5.
Yeah, so we can definitely do your MRI review with the December 2021 MRI, not a problem. However, what we're saying is that if you do need surgery, we recommend getting a new MRI before the surgery. So let's say you do your MRI review and I determine that you need surgery, which you probably do, it sounds like, then you're going to need a new MRI before the surgery. That would be my recommendation. However, you don't have to have a new MRI. if your symptoms haven't changed since the other MRI, you're probably okay with it. I would not get a decompressive laminectomy. I think it's a horrible idea. Laminectomies are going to destroy your spine. Okay? Just so you understand, the lamina is that bone right there. You see that? The laminectomy means the surgeon's going to take that bone out. Guess what? That bone isn't doing anything. That bone is not causing any problems for you whatsoever. How do I know? Because I could fix your problem completely by not doing a laminectomy, by doing the Deuk laser disc repair. I would leave your lamina there, fix the disc, and all your symptoms would go away permanently. So how is it that I can do that without a laminectomy? It's because your lamina is not the problem. Your surgeon is taking something normal out of your body that doesn't need to be taken out. Again, you're going to be a victim of bad surgery, and you're going to live with the consequences if you go through with it. I would strongly recommend you come to Deuk Spine and get better surgery done.
And that is it.
All right, thanks for joining us. It's been very good. Your questions are awesome, and I appreciate them. We all learned something from them. We're going to be back. We have the next surgery actually is a Deuk plasma rhizotomy. We're not broadcasting them yet. I promised you we would broadcast them this year. We're getting ready to start broadcasting them. The Deuk plasma rhizotomy is used to treat facet joint pain. Not all problems come from a disc. Some problems come from the facet joints. Just so you understand the difference, this white thing here between these yellow bones, that's a disc. Facet joint is in the back, right here. You have a left and a right facet joint for every disc. 85% of back pain comes from the disc, 15% roughly comes from the facet joints. So the Deuk plasma rhizotomy is a treatment to fix facet joint arthritis pain. And it's done with plasma, which is a high energy vapor, and it's done to deaden the pain nerves to the facet joints. So that will be our next surgery. We're not broadcasting that. The one after will be a Deuk laser disc repair, and it'll be, I think, a 4-level. So it'll be lumbar, L2-3, L3-4, L4-5, L5-S1. All right. Thanks for joining us, and we'll be back in about an hour.